Good evening, ladies and gentlemen. The May 2nd, 2022 meeting of the Anne Arundel County Council is now in session. Please silence all electronic devices at this time. The purpose of tonight's meeting is twofold. We will begin as the Board of Health. After this, we will go into our regular legislative session. Please pause for the invocation and the Pledge of Allegiance, which will be led by Ms. Pickard this evening.
Good evening. May we listen to one another intently with the purpose of bettering ourselves and our community. May we humbly accept the responsibilities assigned to us. May we carry out each of these responsibilities to the best of our capabilities. Thank you. And the pledge.
Madam Secretary, could you please read the ethics statement?
The Ethics Commission has asked that I advise you that under certain circumstances, members of the public may qualify as lobbyists when they testify before the County Council. If so, the law requires that certain information be filed with the Ethics Commission. The chairman of the Ethics Commission has asked that those who wish to testify in any form review the general information on lobbying sheet located on the ethics website under forms and publications. If there are any questions about lobbying requirements, please contact the Ethics Commission at 410-222-4413.
Thank you. And at this time, we will sit as the Board of Health. I'd like to welcome our health officer, Dr. Nilesh Kalyanaraman. And Mr. Kalyanaraman, you and your team may come down. My understanding is he also has the following members of the health department with him this evening: Tony Gedden, Sean Kane, Mary Lynn Bobbitt, Sandra O'Neill, Jennifer Snyder, Don Curtian, Karen Siska Creel, Thomas McCarty, Crystal Coldiron, and Megan Pringle. And the Mental Health Agency has 4 members here this evening as well: Adrienne Mickler, Catherine Gray, Jen Corbin, and Chelsea Badarnchik. I hope I got that close. All right, whenever you are ready. I know you have a presentation.
Excuse me, I do. Thank you, Chairman Robin, and thank you, members of the County Council. Appreciate the opportunity to be here with you today. Earlier, you did get a set of slides that contains a large range of information. I am not going to go through all of that. I provided that to be complete in terms of what we are doing. I will only go through a subset of that, probably more so in the interest of time than anything else. So I would like to begin with our mission and vision. Our vision is for a vibrant Anne Arundel County with healthy people and healthy communities. And our mission is to preserve, promote, and protect the health of all people who live, work, and play in Anne Arundel County. I appreciate you noting our key staff, Chairwoman. I want to take this moment just to extend my thanks to them for everything that they have done throughout not just the pandemic, but what they do each and every day. They don't get a lot of acclaim, they don't get a lot of notice, but they are what pushes our work forward and makes it so that we are the best health department in the state. As you noted, we do work with partner agencies, particularly with the Mental Health Agency and also with the Partnership for Children, Youth, and Family. And I truly value our partnership with both of them, particularly with Ms. Mickler, who we were just in an event today that I'm going to talk a little bit more about. It is Mental Health Awareness Month. As a brief overview, we were founded 92 years ago in 1930. We have an operating budget of a little over $80 million, and we have 893 employees. That is a significant increase over the past couple of years related to COVID. We are not fully settled yet. That number is likely to go down over time, and we will find our new equilibrium. We have offices both serving the public and for administrative purposes located throughout the county. And this is where I take a moment to also acknowledge the efforts of all of our staff who were made more visible during COVID. It has been a long and trying couple of years, not just for our health department, but for all of those in the healthcare sector and public health across the state and the country. And I want to just extend my heartfelt thanks to everything they do to care for the people of our county. I will start with COVID. It's hard not to, but I think we are in a different phase, and I would like to touch on that. Just as a brief update, we now have 90,000 cases in the county for over the past 2 years, and most significantly, 1,055 deaths. As you can see, this December, January, February, we had the highest number of hospitalizations at any time during the pandemic. I think it is a clear marker that even after all the gains we have made, COVID still throws surprises at us. And it is up to us to make sure that we are ready for what comes next. And I will talk about that shortly. You can see the cases mirrors that. And I think most importantly, this blue line shows the hospital admission rate for people who did not complete their vaccination series. The red line shows it for those who did complete their vaccination series. And you can see that the vaccines provide a tremendous amount of protection. They are not the only tool that we have. We have a range of them, but it is why we have put so much effort into vaccinations and will continue to do so. As a stark reminder of why we care about COVID, we have here 2019 cause of death. We do not have a more up-to-date version, and that is related to data issues from the Maryland Department of Health. And so, of course, we will share that once we have it. But we did want to show you what the preliminary death counts for COVID in both 2020 and 2021 look like in comparison to our annual cause of death. And you can see in both of those years, they would have been the third leading cause of death. And that was with all the layers of intervention and mitigation that were in place. Obviously, as time has gone along, we have a different set of interventions, and the burden of responsibility is shifting more from a collective one to an individual one, but it can never fully shift to an individualized responsibility. We all bear responsibility for our public health. But this is, I think, a good reminder of why we care about COVID. So where are we headed here? We're in a different phase of COVID at this point. We have disease surveillance, and that continues to grow and improve over time. Vaccinations are a critical part of what has changed, and I've bolded the four items that have changed the most since the beginning of the pandemic. So one of those is vaccinations. Obviously, it was only in December of 2020 that we first saw vaccinations, and it took a good portion of the first half of 2021 to roll them out. We are still waiting for a vaccination for 6-month to 4-year-olds, and we are obviously learning more about what the schedule of boosters are going to be. We are in the early days. It is still less than 18 months since the first vaccine came out, and so we are learning and adjusting, and those schedules will come into a better cadence, we expect in the next year or two. Testing is the second thing that has changed significantly since the beginning, and most importantly, that's at-home testing. That has changed how we approach detection and diagnosis of COVID-19. We've seen repeatedly that when case rates go up, there's a crunch on PCR testing at testing sites, and not just the health department, but no site can truly ramp up adequately for that level of testing. And more importantly, given the range of symptoms that we see, having an easier way to do testing has been critical in changing how people approach this. So it was only in the last few months of 2021 that we saw true availability of at-home testing. Our health department was, I believe, the first county in the state that really aggressively pushed that and pushed those out. We've distributed over 175,000 of those tests now, and we will continue to do so. We've actually built up some stocks of at-home tests to be able to put out to the community when we see demand increase for that. The third piece is masks. Obviously, our understanding of how masks work and which masks work best has changed and shifted. We have also in the past few months past 6 months, seen much greater availability of KN95 and surgical masks. Those are the highest efficacy masks and have been distributing those to the public. Cloth masks do work as well if they have multiple layers, but they are certainly a second choice compared to those others. We have been involved in PPE distribution. Health equity has been a core concern of ours, and I'll talk about what some of our interventions are and what the results are. Communication has been and is an ongoing concern, and that will be as we go forward to convey recommendations and where we are. The fourth item that has truly changed since the beginning is treatment. Initially, treatment was limited to the inpatient setting. There weren't adequate oral treatments. That changed at the end of 2021. It did not change soon enough for the surge that we saw at the end of December, January, February. But it is available, and I think our big challenge now is getting people connected to treatment so that they can get the medication. We hear over and over again, not just from the community, but from our partners at the Maryland Department of Health and providers, that while the medications are in the pharmacy, there are challenges in getting people to recognize that they can seek treatment, in getting providers to provide that care, and in getting people the prescription so that they can fill that medication. But that is a critical tool in decreasing the severity of illness that we see with COVID-19. And then the last is going to be data reporting, and we will continue that obviously in a different format as we get into a more settled cadence. It's also been affected by the data issue out of MDH that is resolving, but it is resolving a little bit slower than we had anticipated. Just as an example, I'm going to highlight our work with rapid test kit and mask distribution. We distributed through a number of sites, particularly the libraries. They have been a tremendous partner in this work. We just kind of think of them as go-to community sites for people to get information. We've set up vaccination clinics with them, these masks and tests, of course. But I think much more importantly, it's been a partnership across a wide range of county and city agencies and a wider range of community partners. We have our health ambassador programs. We work with the faith-based community, homeless shelters, food pantries, recovery houses. Business partnerships have been tremendous. Arundel Mills Mall and Live Casino have been great partners, not just in this, but in vaccination efforts and other efforts as well. And of course, our federally qualified health centers. Truly, this has been a county-wide effort across a range of sectors and partners. One of the efforts that we're really proud of that really bent the curve on this is our Health Ambassador Project. Its goal was to expand outreach and provide vaccine information and education in underrepresented and minority communities. Key to it was that we granted out money to these community partners so that they can hire health ambassadors from local communities and neighborhoods. We know that we can't be in every community, but more importantly, we don't know every community at that level, that those partners in the community know them. And so a piece of this is also building capacity, and what we saw was that in zip codes where our community health ambassadors were present, actively performing outreach, we saw a 20% increase in COVID-19 vaccination rates. And that was in contrast to only a 12% increase in non-targeted zip codes. This kind of direct outreach is effective in connecting with people in the community. I think critically, when we saw vaccination rates lagging amongst African Americans and Hispanics, we saw that during this time, there was a 21% increase in vaccination rates for African Americans, 29% for Hispanics, compared to a countywide 17% rate increase. So once again, these are the types of programs that really help shift our standing in communities and with individuals so that they're getting the care that they need. And then I want to highlight just our vulnerable population support. This is something that we've been doing since the drop. Our work with homeless shelters, corrections, and our homebound programs. These have been critical to fill the gap, and this is truly where we focus a lot of our energy on, is the people who don't have a lot of other options, the people who would otherwise fall through the gaps. They are the ones that we are paying very close attention to. I'm going to transition out of COVID now and talk about our core programs. I'm going to start with our Healthy Anne Arundel Coalition. This is a county-wide collaborative. It's led by the Department of Health, and it includes community organizations, faith-based institutions, economic development, our FQHC partners, hospitals, and other county government agencies. And its purpose is to identify and address our community's priority health needs. And we determined that by asking the community, what are your priorities? And then we take that, and our goal is to align our resources across these organizations to reach those goals. Instead of all of us doing different things at different times, trying to work with the community, seeing 3 or 4 or 5 organizations jockeying, we'd prefer to coordinate our efforts. And the focus areas that the community identified were mental health, obesity, COVID-19, obviously, during this time, and healthcare access. COVID-19, I'm going to leave to the side. We've done a lot of work on that, but I want to focus on those first 2 items. Those are the ones we have actively worked on, and then we will get to healthcare access sometime this fall as our 3rd item. So our mental wellness work group, and I want to thank Adrienne Michael once again for her leadership on this. One of the things that we saw come up consistently was this mismatch between what residents identified as their needs and saying, you know, we need this service, we need to have this type of intervention, and providers saying, well, we do this, but we do that too, and we do that. And so there's a gap between when people need something, knowing how to get it, and connecting them with providers. Now, that doesn't close the entire gap, but it does get us a good part of the way there. And so one of the key pieces here is that the county network of care, which is a way to connect people to mental health and substance use disorder resources, we're going to be relaunching that in a more robust format later this month. The goal is to engage providers to be a part of that so we can make those connections. And then we want to get community members as part of this as well so that they are able to get this message out, be able to help us with how are we communicating with the public. The other group is our healthy eating and active living work group. This was in response to obesity being a core concern. And the areas that have come up are increasing community access to healthy and nutritious foods, increasing community options to participate in exercise and physical activity, and then education around healthy eating and active living habits, as well as decreasing risk factors for diabetes, which is a state health priority. And we're going to be doing this through the partnerships that we're creating and enhancing. Moving along, I want to talk a little bit about our work on health equity and racial justice. We've talked about this in the context of COVID a little bit, and that has been our focus. Of course, COVID has been the core focus for the bulk of the past 2 years. But there's more to it than just COVID. And health equity means that everyone has a fair and just opportunity to be as healthy as possible. And then when we talk about racial justice, we're talking about the challenging institutional and structural racism to make sure that we're creating a just and equitable society. Data shows, and I'm going to show you that in a minute, that there are racial, ethnic, income, and geographic disparities in our health measures. And so in 2019, Anne Arundel County declared racism a public health issue. I will note that in 2020, this department, the Health Equity and Racial Justice, won the Maryland Association of Counties Innovation Award. So what is this data? It's data on education, racial and ethnic minorities. The education is in green. The areas that have a darker green color are areas with higher rates of people who have less than a high school education, so lower educational attainment rates. So darker green is bad, if you will. In the orange map, look at percentage of population identifying as racial or ethnic minority. If you see a darker reddish orange, it just means that there's a higher rate of racial and ethnic minorities in that area. And then the last one, the purplish blue one, is median household income. Areas with a darker color have a higher median household income, so the palest colors are the one with the lowest incomes. And I know it's a little small, but I think it helps to be able to see them all at the same time, to see where the areas of commonality are. Because it all adds up to life expectancy. So when you look at this, the areas that are lightest have the lowest life expectancy, the areas that are darkest have the highest. We see our highest average life expectancy in Arnold, 85.9 years. Our lowest in Brooklyn Park, 70.9 years. That's a 15-year gap, and that's about a 15-mile drive down Ritchie Highway. So if where you live is far more important to how long you live, we've got some work to do. And it's why when we look at these drivers of life expectancy, race, geography, they impact your ability to access education, to attain a good income. And ultimately, that impacts your life expectancy. And so I want you to keep that in mind as we go along, because it's going to inform the work that we do and how we can address those drivers and understand them in the context of health. We can't solve them from the health department. We're not trying to. But I think that as we think about what health means and how we approach that as a county, it's important to keep these items in mind. One of the pieces of work that we do through our Health Equity and Racial Justice Department is our community health worker. I mentioned our community health ambassador program. These community health workers are the ones who work in the health department, and they go out and they do outreach with the goal of linking to the community to services like financial assistance for rent, utilities, food support, transportation to medical appointments. Those keys that I think we all know impact directly on the ability to be healthy. A key part of this is engaging with the community. That's a theme you'll hear over and over again. We have monthly meetings, as with everything. Initially, it was focused on COVID. We have been, over the past number of months, expanding the range of topics that we are covering and use it to both share and explain data and also to understand current concerns, barriers, and opportunities for collaboration within the community. Another core issue is gun violence, and the gun violence intervention team is a multi-agency effort that we're leading out of the health department to address gun violence as a public health issue through community engagement, data, and evidence-based practices. And we're focusing on gun violence because it has disproportionately affected different groups in the county. I think it's really important to understand that when we talk about gun violence, there isn't one manifestation. I think the popular conception is that there's mass shootings, homicides, suicides. But the truth is that suicides constitute roughly 2/3 of the deaths from gun violence, with homicides making the other third up. Mass shootings, while horrific, are not that common, though we have suffered through that in our county as well. And then when we dig into the data a little bit more, we see that homicides disproportionately affect Black males, and while that data is not here, typically younger Black males, while suicides disproportionately affect white males, and typically middle-aged white males. I share that because I think it's important to keep those two different types of gun violence front and center in your mind as you think about what work we are doing, because there are some interventions that are common to both suicide and homicide, and there are some that are more distinct to one or the other. So our work group has 3 priorities. One of them is data, and to create and publish a monthly data report. Share with you here some year-on-year data on homicides, suicides, and crimes. You see that in 2021, we saw a slight increase from the prior year in both homicides and suicides. It is something that we are monitoring very closely. This is just a snapshot of that data that I said that we are sharing monthly. It can be found on our website and shows a map of both gun-related homicides and suicides and their rough geographic distribution to be able to understand where it's happening, who it's affecting. You can take a quick peek at this map right now and see that there are some differences in the distribution of both homicides and suicides, and that's important in terms of how we are approaching communities and talking about this issue. It's going to be different in different communities. Education and policy is the second of the 3 items that we are focusing on, and it's a multifaceted effort to implement a public awareness campaign around gun safety. So far, we've distributed 4 separate toolkits: suicide prevention, a youth gun safety toolkit, a domestic violence toolkit, and a responsible gun ownership toolkit. And the goal is to provide information and resources for people to be able to use to be safer. These are just a couple of the examples. One is from the Suicide Prevention Toolkit, and one is from the Youth Gun Safety Toolkit. And then our last item, the one that we is focused on the environment, looks at implementing a coordinated crisis response for reporting and following up on gun-related incidents, and that work is in its early stages, and we'll share more about that. So I want to transition to our behavioral health system. It's pretty apt considering that May is Mental Health Awareness Month. We have an extremely strong collaboration between the health department and our behavioral health side. We are the local addictions authority, and our mental health agency, which is the mental health authority. Together, we are the local behavioral health authority. And our goal is to really facilitate a strong local behavioral health system that's integrated, can handle complexity, and contributes to the overall health and wellness of our county residents. Our local behavioral health authority just put out its annual plan just a few weeks ago, and it's really focusing on 5 areas. I want to touch on them briefly. And they dovetail with other efforts that we're talking about. I mentioned our mental wellness work group in Healthy and Arundel. You've heard about the mental health task force. Our goal is to make sure that these efforts are synchronized and are not at cross purposes to each other. So the first one is enhancing, expanding a comprehensive and collaborative communication system. That's critical, and the network of care that I just mentioned is a part of that. Expanding training and workforce development opportunities is critical. What we're seeing is that there is a shortage of mental health professionals that has only been exacerbated by the pandemic. And while we all want to hire more people, everybody is in that position. And so there may be some short-term steps, but we also need to build that long-term pipeline, both here in the county and across the state, to be able to increase the workforce that is able to do this work. Third is supporting a system of primary prevention, treatment, and recovery services across the lifespan that adapts to the county needs, and particularly prevention. You know, we've talked a lot about treatment and recovery services, and we are going to continue to invest in that area. But prevention is also a key part of what we do. We talk about prevention a lot on the physical health side. We don't talk about it as much on the mental health side. And I think that's because a lot of our effort has been to actually make treatment and recovery services more available, right? Those are always the more pressing needs. But as we get greater traction on that, we want to talk about prevention. What does it mean to be able to teach people mental health first aid, give people tools to be able to cope with stressors, seek care when they need it, and ultimately to have people have greater mental health and wellness. The fourth is increasing public access to and awareness of behavioral health services. And then the fifth is making sure that we're collecting, analyzing, and disseminating data to inform our programs, policies, and evaluation. So I'm going to start off with suicide prevention. I touched on it briefly with the gun violence work, but there's much more to it than that. What we've seen with suicides is that while they've remained fairly steady, there has been a decrease since 2018. We have seen decrease from about 85 deaths in 2018 to 68 in 2020. And there's a range of things that go into that. We have our mental health task force, which I just mentioned, mental health first aid training that's happening with police, the school system, libraries, faith leaders, and community organizations critically. Lethal means reduction through safe storage, STAR program in the school system, which enables substance use and mental health referrals from students, started in high schools, is expanding to middle schools. Mental health clubs in high school, suicide awareness campaigns, our 24/7 warm line, and our suicide prevention awareness series. We also put out mini grants to community organizations to address mental health, suicide stigma, suicide prevention, awareness, back to that same idea of community engagement and getting community organizations to be able to do outreach to the community members they know well. there's, of course, been an effect of COVID-19 on behavioral health. We've seen at least a 30% increase in requests for services through the crisis response system. On the other hand, we have seen a slight decrease in opioid overdoses by about 18% from 2020 to 2021. So it's a mixed picture. There's obviously been effects on families, children, the elderly. There's isolation, loss of income, loss of family and community members to COVID. It is going to be a challenge that we are going to have to work through over the coming years. What we've seen is that anxiety and depression have decreased since the beginning of the pandemic, but are still higher than pre-pandemic. There are increased telehealth options for individuals, which is a good thing. It's also making it a little bit more challenging on the provider side in terms of being able to provide in-person services. And there's been about a 20% turnover in healthcare workers in the past couple of years. All of this to say that the picture is shifting, and is shifting rapidly. On the plus side, more individuals are discussing behavioral health, wellness, accessing care. There's increased service demand. There's greater conversations on reducing stigma, and most importantly, as I noted, there's a focus on prevention, really pushing upstream. As I noted, this month is Mental Health Awareness Month. We just had an award ceremony for students who described what is your superpower contest with ACPS. It was lovely. It was the nicest thing I've done today, by far. It was really lovely. No disrespect, but cute kids win anytime. But it was really nice to see your youth engaging in this idea of talking about mental health, about talking about how they cope, how they help their friends cope. The student who won the grand prize talked about not being a bystander, about engaging and helping others when they saw that they were in trouble. That's the kind of thing that I can't even imagine when I was growing up, but it's really heartening to see, and it's how we continue to advance. And I think that our kids are in a better place to even understand these issues and seek help. In terms of substance use, our Wellmobile is out and running. It has been available 5 days a week virtually throughout the pandemic, of course, but it is also physically 2 days a week in Annapolis, a day a week in Glen Burnie, and then also 1 day a week in South County at Lewis Scott for the past few months. Safe stations continue to see high demand. Safe stations, as a reminder, is for anybody seeking substance use treatment. They're welcome to a police or fire station 24/7. It's a way to use our existing public safety staff to be able to provide this kind of touch point for those who need it. Done over 5,600 assessments since the program began, and I think really importantly, there's been a growing ability to be able to do assessments in the community rather than at a fire or police station. There are reasons that this is helpful both for people seeking help and also for the fire and police services. And I think critically, 70% of all those who were assessed were connected to substance use treatment. Harm reduction is another key part, and particularly Narcan. What we're seeing from our data is that somewhere in the order of only 25% of people who died from an overdose had received Narcan. For those who survived an overdose, that number is closer to 90% having received Narcan. It shows the stark effect of Narcan on survival and allowing people to then enter treatment or recovery. And so it's going to continue to be a key part of what we push out to make sure that people understand not just what Narcan is, but that they have it available, that they understand the Good Samaritan laws, and that we make it more easy to access. Our opiate intervention team is cross-agency across the county and the city, and includes people in recovery, faith-based organizations, family members, and its goal is to create a unified program to address our opioid crisis. That means looking at our public safety, our judicial system, looking at health and human services, and making sure that they are collaborating on this effort. One key part of that is our overdose survivors outreach. We had been doing overdose outreach to people who initially went to the hospital, to the emergency room with an overdose, but we've expanded that program at the beginning of this year. Working with the Anne Arundel County Police, we get information on them when they find out if somebody has overdosed. We get that in near real time, usually within a couple of hours, and then within 24 hours, we are doing outreach to that person in the community. So we've done 95 overdose survivor outreach attempts. We've reached about a third of them, and 2 have accepted referral for substance use disorder treatment. And this is just the first few months of this program. We're going to continue to build this out and build awareness of this. And we are going to be expanding this into Annapolis City. We're working with the Annapolis Police Department to get their data as well, so that we can begin that as outreach as soon as we have it. Our crisis response system services, they're really key towards preventing crises from escalating into more intense situations. So their outcomes are reducing hospitalizations, reducing incarcerations, reducing homelessness, and truly eliminating barriers for vulnerable populations. They're going to connect people to treatment, resources, other benefits, and coordinate with other county departments, including housing, transportation. The best way to think of them is that if there's something happening out in the community or even in an emergency room, they have the resources and are able to do it in real time to be able to connect those people in crisis. If they need housing at that time, and then connection to treatment the next day, and they also need to make sure that that their rent is being taken care of. They can help sort through all of that so it doesn't turn into something much worse. It doesn't turn into an incarceration or an encounter with the judicial system or an inpatient admission, when really none of those are actually going to solve that person's problem and are really going to just add another layer of problems for that person. We've talked about the fact that our crisis response system is internationally recognized. They have seen an increase in demand. You can see here that calls have gone up, crisis intervention teams there's been a greater demand on them, nearly a doubling in the past 2 years, and our mobile crisis teams have also been dispatched more than 30% more compared to 2 years ago. Along with providing services, they're also providing training in the community. I mentioned mental health first aid, and I think it's probably the most important piece here. It is the piece that is geared to anybody. Just in the same way that we can all learn first aid for injuries, we can learn mental health first aid to help identify signs and symptoms of mental illness. And what it does is it gives a person the resources to be able to help that person, not to be their counselor, not to be their therapist, but to be able to direct them to care if they need it, to be able to recognize what's going on, and truly to provide first aid for those who need it. While we've been doing this with ACPS, school nurses, health aides, teachers, I'm really excited that we're doing this with faith leaders, with community organizations, outside of the usual systems that are thought of as healthcare, or that have a traditional obligation to that, because that's really going to change the needle on this, right? That's going to be trusted community leaders having the tools to recognize what's going on and not chalk it up to something else. So often we talk about somebody being difficult or belligerent or something. There's usually an underlying issue, and this gives them the tools to know that. And then lastly, on crisis, mental health stabilization services. This is responding to schools. This is particularly targeted to youth, responding to schools and to the community to assist youth and their families during a behavioral health crisis. Obviously, when you're engaging a youth, you need to be able to engage the family as well. And this is a core tenet of how they do their work. They've seen good results with this. Parents report typically a decrease, about 36% decrease, the intensity of their behavior, or a 41% decrease in the perception of their problem during their engagement with these mental health stabilization services. transitioning out of behavioral health to our communicable diseases. During COVID, our team did not stop their work on other communicable diseases. Obviously, COVID has monopolized their time and efforts, but there are still 95 other reportable communicable diseases. I just give you a snapshot here of the work we're doing around sexually transmitted infections and HIV. This is the kind of work that is critical. Over this 9-month span, we saw 9 positive HIV cases. That's a lot. We want to continue to take efforts to reduce transmission, increase awareness, increase testing. As an example of what happens when these types of services are not coordinated, if you've been following the news in West Virginia, they're having a true HIV epidemic. It is a population about 3 times the size of our county. They've had over 100 cases of HIV, new diagnoses of HIV in the past year. And what is happening there is that there is not data sharing with those counties that are being affected. They're not able to do outreach and intervention. And that's what happens, right? That's what happens when we're not able to do prevention in the community, when we're not able to deliver resources and services to individuals. And so I always like to talk about prevention as kind of the silent success. When you prevent something, there really isn't terribly much to report. That's the point. 9 is still a lot of HIV cases, and we're going to continue to push that down. I mentioned that there are 95 reportable diseases. This is just a small sample. These 6, but aside from COVID-19, these 5 are the ones that we see most commonly. But our staff are tracking all of these through partnership with the Maryland Department of Health, in partnership with doctors' offices, hospitals, doing contact tracing where appropriate, doing outbreak investigations where appropriate. Key to many of these communicable diseases is the prevention piece. Immunization services are a core part of what we provide, particularly to those individuals and particularly children who don't have access to either routine care or who don't have insurance that covers vaccinations. We are a safety net for children and adults for vaccines. This is the range of immunizations we provide. As you can see, we span the gamut here. Just as importantly is our partnership with ACPS and making sure that kids who are entering school have the vaccinations that they need. We have been taking advantage of the fact that we've had a closer partnership during COVID-19. We've obviously set up COVID-19 vaccination efforts with them, and we've increased that to include other childhood vaccines as part of our vaccination campaigns at schools. Moving on to our healthy food pantry, we talked about food access and healthy eating as a core concern. Our Brooklyn Park Healthy Food Pantry is one piece of that, and it is something that we are looking to promote elsewhere in the county. What is key to this is that it makes sure that families who are coming there get fresh fruits, vegetables, grains, dairy, proteins, in addition to dry goods and canned goods. And so this really, for those of you who haven't been there, I strongly suggest you go. It's really just an amazing operation. It's really just, it's fantastic to see the range of foods that are there. And it's truly what access to healthy food can look like. When we look at our families, I mentioned nutrition. Another piece is making sure that families have a healthy start. That's our Healthy Start Home Visiting Program. It's targeted to women who are impacted by substance use and are in high-risk zip codes. It provides mental health, interpersonal violence prevention, and substance use screening, health information, referral to resources, and then it provides parenting education, and that's kind of the key part of this, through nurses, parent educators, and therapists. So a range of service providers to be able to provide that, to really make sure that those mothers and those families get the resources they need to start out that infant's life. Dental services are also another key safety net service that we provide. I provided just a snapshot of the services that we are providing to both children and adults, but largely to children. That is where our focus is. On the prevention side of things, our dental sealant program, we work with a few elementary schools, those Mills Parole, Tyler Heights, and Georgetown Elementary, where there are kids with the highest need to do things like a dental sealant program. Dental sealants are a preventive service that you offer to 6 to 9-year-olds to seal their molars, their permanent teeth, so that they don't get cavities. Yep. Gotta count those teeth. REACH is another key program that we coordinate. It's a way that we can connect people to low-cost primary, preventive, and specialty health care, to people who don't have insurance and low-income individuals who are unable to afford care. It's been a key part of our efforts to keep people healthy. There have been some changes to Medicaid that were made just in this legislative session that we're looking to incorporate. That's actually going to change some facets of the REACH program for us. I just wanted to highlight this to note that there's over 100,000 people in Anne Arundel County who receive medical assistance. That's about 17% of our population, about a little over 1 in every 6 people in the county. That's important because Medicaid serves the lowest income individuals and those with disabilities and other special considerations. We do a lot of work in partnership with Healthcare Access Maryland to make sure that people can enroll in Medicaid when they need to. Medicaid is a year-round, you can enroll in it year-round, but also to do redeterminations. Every year, people who are on Medicaid have to be reassessed for their income or for their status or condition to ensure that they can stay on the rolls. That has been hard during COVID, obviously, but even at the best of times, that requires paperwork. People fall off those rolls. They see gaps in care. So that's been a key part of the work that we're doing. Moving on to our school health room services, just providing a snapshot of the visits that we see. As you can see, there's a wide range of reasons that we see people in the health room, but particularly wanted to note some of the data around mental health. In terms of crisis interventions that our school health room staff are seeing, they've actually seen a decrease in visits for violence, suicide threats, substance misuse, social emotional needs in the past year. We don't really quite understand that. We believe that a good part of that has to do with the COVID-19 safety protocols, decreasing some portion of visits. It's definitely something we're going to keep our eye on, particularly considering that we just showed you data from crisis intervention and from earlier that shows that there is an increased need. And so, just a note of I would say an anomaly here that we need to keep our eye on. As I noted, our crisis response system notes that there's an increase in children's needs. This is, of course, outside of the school setting. I'm going to take one moment to just note, I don't typically focus on our staff, but I do feel the need to do so. Here, in this particular instance, our school health staff have been particularly hit hard during COVID. We've had 70% turnover on our school health staff in the past 2 years. That is astronomical. We've talked about the fact that our school health staff are paid at a lower rate than comparable counties. And between that and the toll that COVID takes, it has been extremely challenging. I'm going to take a moment to thank Karen Siska-Creel for her work, her dedication in keeping that school health staff and running. It's taken a lot of work. And it is a core part of school. Every time I visit a school, the first thing the principal tells me is how integral that school health nurse is to their staff. It is touching to hear that. I think we need to invest in that. The last item I want to mention is our oral rabies vaccination program. Kind of continuing on the theme of what happens when prevention goes away. We used to see nearly 100 terrestrial animal cases of rabies about 2 decades ago. As we began our oral rabies vaccination campaign, we saw that number plummet, and it went countywide in 2011. We lost our funding for a couple of years, and pretty quickly you saw that number start to go back up again. We don't always get real-world examples of what happens when prevention goes away, but this is a good one. I think it's important to highlight how successful this has been in decreasing the number of rabies cases in the county. And so with that, I have blazed through this as fast as I could, because I know there are going to be questions. So with that, thank you for your time.
Thank you very much, Dr. Kalyanaraman, and everyone here from the Health Department and the Mental Health Agency for all of the work that you have done. Obviously, we are in trying times, and I imagine you are just tired and just, trying to stay above, trying to keep going. I see a couple lights from my colleagues, so Mr. Pruski.
Thank you, Dr. Kalyanaraman, and obviously the staff. You certainly have been through a lot, and I think I speak on behalf of not only the council but the citizens, the work that you've done, and we appreciate it. I know you skipped over it real quick, but there was a policy decision by this council to keep a helicopter to help with the rabies drops. And I just want to be clear on if that is still being utilized and how helpful that has been throughout the county to lower that number. I noticed you had a bump there, and I was just curious if that investment that's not only used for our police but also for health programs, if you could kind of maybe talk about that. Thank you.
Absolutely, Councilman. So we absolutely use that helicopter. It's critical to be able to drop bait on forested areas that are not accessible on foot. Particularly just the landmass that's covered by forest in our county is a valuable asset, but also really hard to bait. So we appreciate that. It has been a key part of our program.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. First, a quick comment and then a question. But you didn't touch on this in your presentation, but I think slide 132 in everybody's pamphlet is on the vision and hearing screenings that you all do in the schools. I just wanted to tell you that actually you caught my daughter on the vision screening, and I never otherwise would have known. Took her to get glasses, and then actually I forgot to send back the form, and you all followed up and made sure that I actually had taken my daughter. So I just want to say that is a really cool program, so thank you all for that. I think it looks to me like from the numbers here, the number of folks that you're referring, you're catching people really early, which is awesome on the preventative side of things. On the presentation, my question, and you probably know I'm going to ask about this, we've talked a lot about trying to mimic the Brooklyn Park food pantry stuff that you do down in the Lothian area. Do you have an update on that? How's it going?
Yeah.
Where are we headed?
So we are actually in the process. So we're already engaged the CLF, Center for a Livable Future.
Yes.
Yeah, sure. I can stumble.
No, so we have, actually, we put out an RFP to work to do an assessment, which is similar to the way that the Brooklyn Park Food Pantry came to be, which is what are the needs of the community, having conversations with the community, and just this week, I believe, many grants to community organizations to actually do that work on the ground, to talk to citizens, to see what's happening. That's going to be happening in South County and starting really soon. So that's really where we are. We've picked an organization to work with, and we've got a timeline. So hopefully by the end of the year, we'll have an assessment of what the needs are in South County to be able to replicate something. It's a much bigger landmass than Brooklyn Park, so looking at doing it slightly differently than what was done in Brooklyn Park, but starting that work.
May I ask one quick follow-up? Thank you, Madam Chair. Assuming then that the assessment's done by the end of the year, where would that put us in a timeline for actually getting something started?
Yeah, that depends on what the assessment shows and what the community is looking for.
Okay.
So if they're looking for a pantry, I'm not exactly sure what the timeline would be, but we're open to what the various options may be and what the community says they want.
Okay, awesome. Thank you so much.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So I was trying to put a few slides together to ask this question. So it looks like warm line, crisis intervention, mobile crisis, those numbers year over year are ticking up. But youth crisis and calls to the school or dealing with students is going down. Did I get that right?
Sort of. So
Okay.
the ones that went down, Councilwoman, were the ones to the school health staff specifically, and we think that
Okay.
might be related to just the COVID-19 protocols and kind of just a slightly greater, strictness of how things are moving inside the schools.
Okay, may I ask a follow-up? Do we have any information on youth numbers? I know that that's been an area of focus for you all and for, our local hospitals. Do we know if those numbers are flat, if they're mimicking the crisis calls, or any information?
Yeah, sure. So when you say youth numbers, help me a little bit. Like which specific ones, or just in general?
In general.
Okay.
I mean, I know that there was a period of time, and from all understanding that there still is a larger than normal prior to 2019-20 cases of children in pediatric emergency for mental health related challenges.
I'll make sure we get you, but you saw that the data is really through 2020, and that the problem is a state issue. We don't really have the ability to do anything beyond that at this time.
Okay. Would you be able to, sorry, Madam Chair, one more follow-up on that one? Okay. As that information, I'm sure, is released, even if we're not sitting as the Board of Health, would that be something that you can send us in, real time?
Absolutely.
Okay.
And what I'll do is when we go back, I can just double check to see if we have other sources that may be 2021. It's unlikely, just because the data breach at the Maryland Department of Health in December just means that we're not getting anything. Like that's a year-long reporter kind of thing. But I'll double check and let you know either way.
Okay, thank you.
Ms. Lacey.
Thank you, Madam Chair. Dr. Kalyana-Raman, I have a couple of, three questions maybe, but they all link to the idea of the geographic life expectancy gap. And at the end of your presentation, you addressed the number of health room visits in the whole school system, over 361,000 in one school year, I think is what that was. So roughly that's 4 or 5, I think, visits per child enrolled in the school system. And I don't know if you have information on how that's distributed by age, but when I looked at that number and then the number of the crisis warm line calls for children's needs and how those have drastically increased over the past couple of years, when you put those together with, well, okay, I'm going to bet that probably a lot of those calls and a lot of those visits are also happening in areas with a lower life expectancy, and that there is almost certainly, I mean, I obviously don't have like a study in front of me to point to say, is this what really happens? But I would have a hypothesis that these children are going into that same lower life expectancy pipeline, essentially. And so my question is really, what can we do now to be able to measure the effectiveness of what we're doing for children? Because I think you can fairly ask, are the kids all right? Well, it doesn't really look like that they are overall. And I struggle to perceive from these different points of data, what does that really mean, and what can we do to be most effective to improve their situations?
So I think that there's a couple of things in there. One is and this comes up in our conversations around the opportunity gap as well, is recognizing that getting kids set up to begin kindergarten should be our goal, right? In the same vein of prevention is much better than the treatment, it's harder to fix a gap once it's manifested itself. So I think that our focus really should be on the first few years of life, right? What are the conditions? We talk about the adverse childhood experiences, but that's just a kind of technical way of saying, what's the situation that you're growing up in, right? What are the educational opportunities? What is the food access? We talk about food access, but nutrition is important. We know that. We intuitively know that. We align our households around that. But for families that can't do that, it's penny wise and pound foolish to say, well, oh well.
Right.
So I think that we need to look at what our policies are, particularly in the first few years of life, and how do we assist those families who have the greatest need? And you'll find that, right? in the zip codes with the lowest life expectancies. We know where to look.
I think we have a lot more thinking to do, Dr. Kay. So, thank you.
Mr. Volkey.
Thank you, Madam Chair. Question for you about the medical assistance eligibility program. So you indicated there are 100,000, almost 101,000 residents. I think it's page 124. Do you have any historical data that shows how that compares sort of year over year and whether we're seeing more residents on those programs, whether that's changing, whether it's staying static? Do you have that? I know you don't have it in here, but maybe you can get it or if you know it.
We'd be able to get that. We definitely know that we've seen an increase in Medicaid enrollment during COVID-19.
Okay.
So we'll also look back a little bit further than that, just to give
Appreciate
kind of a pre-COVID trend line.
Yep.
I'm not sure who was next, so I will go with Ms. Harrigan.
Thank you, Madam Chair. Jessica here, District 7. Looking at slide 59 and 60 on the data about homicides and suicides, I just want to make sure I'm understanding this correctly. The percentage increases that you have, 2019, 20, 21, are those year over year, or are you comparing them to a baseline?
Year over year.
Year over year, okay. And then on slide 60, on the very left-hand side where it says gun-related homicides and it says year-to-date total, it doesn't say on there, I assume that's 2022, or is that, because it doesn't.
The one with the maps?
Yeah.
Yes. So that is, forgive me, that's meant more to be able to say this is what it looks like. If you go to our website, you'll be able to see up to date, and that is year-to-date information.
So then am I understanding this correctly, that year-to-date total of homicides, let's say of 15, that puts us above where we were in 2021 at this time? 11%, 11% up over 2021? And then homicide, you could do the same evaluation. I mean, suicide, that's correct?
Yes.
Am I reading it right? Okay, thank you so much.
If I may just say one thing.
Go ahead.
On an unrelated, I just want to say thank you for sharing that about the vision screening. Our health department was, I think, one of only 2 in the state that continued vision and hearing outreach screening during the pandemic. So it matters.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I just want to go back for clarification on slide 104. There's some information, this is the HIV and STI prevention and care program, that the data is impacted by the state incident, but the 9 positive HIV cases that you touched on, is that an abnormal number in a, 10-month time frame for us, or is that what we typically see?
It's not an abnormal number. It's within the range.
Okay.
But it's one that we track to see, well, what more can we do to push that down?
Okay, I just wanted to clarify because it was shared with this story from another state, and I just wanted for the record to understand that
Yes.
this is not abnormal for us.
That is correct.
Understood, thank you.
Mr. Volkey.
Thank you, Madam Chair. Doctor, I'm going to give you an opportunity to maybe correct something because I'm not quite clear on it. You were asked a question about this slide 60 about whether we were up 11% year over year on gun violence or not, on the homicides. Did you mean to say that we're up 11% year over year? I'm only asking because I have the police statistics that show the year over year from 2020 to 2021, and they don't reflect what your slide shows. So that's why I'm not clear, because what I have from the police is it was the same number. There were 19 in 2020, there were 19 in 2021, but you're showing a different number. So I just want to make sure for the benefit of people watching, are you saying homicides are up 11% or not?
So if I may, Councilman, when you say the police, are you referring to, so this is including Anne Arundel and Annapolis Police Department data.
Gotcha.
So we see that sometimes there's a discrepancy in which set you're looking at.
Okay, so if you're looking at this set and you're looking county-wide,
Correct.
city and county,
Correct.
then it is up.
Yes.
But if we're just looking at the county, then it's the same.
I can't actually answer. I take your word of that.
I got you.
We're putting it all together. So
Okay, all right, that's what I want to clarify. Thank you.
Go ahead, Ms. Hare.
Thank you, Madam Chair. Jessica, I just have one more question on that line, because I was asking about kind of how we're looking in 2022 compared with 2021, based on this 15 on the left-hand side. So when I asked about whether we're up year over year. I'm talking 22 so far, trend line compared to 21. How are we doing there?
So when you're looking at this map, what you're if I'm reading correctly what you're saying, you're looking at that 11.1% year over year, right?
Correct.
Under the 2021, the 10.
Yes.
The 10 that's noted there.
Yes.
This is just a snapshot at that time. So if I may, I'd like to share the data that's most up to date from our website, and I'd be
Okay.
able to go through that in greater detail. It's just
Perfect.
hard to work off of this because this wasn't meant to be a data set to work off
Sure.
of.
Okay. So I would be looking for then, I guess, you've got 2019, 2021 here. I'm curious how we're doing in 2022
Yes.
now looking.
And
Okay,
I can,
perfect.
yeah, I'd be happy to share that. This
Awesome.
is just a big challenge.
Thank you so much. I appreciate it.
I'm going to jump in and ask a question here. We've been talking a lot about youth mental health, and I definitely share the concern. I've seen it in my classroom or in my various classes at my middle school. But one of the things, and obviously there are many, many causes for this, but one of the ones that we've heard a little bit about in the media and that I feel like I observe anecdotally is the impact of social media and cell phones. And I'm wondering if that's anything, if there's any quantitative data yet or any sort of look at just looking at that issue and policy changes, or, I mean, obviously AACPS would need to be involved with respect to that. But in addition to, just being disruptive, I think there's, we see the mental health impact, and I know there's been testimony in Congress about that. So I'm curious what you know with respect to our county.
Yeah, I'm going to actually invite Ms. Meikler up because I know we've talked about this a little bit. To talk a little bit about that. That's actually one of the things that came up specifically during the mental health task force.
Sure, thank you, good evening. Adrienne Meikler, Director of the Mental Health Agency. Absolutely, as part of the Mental Health Task Force, social media was one of the risk factors that was identified as being a key element in children's mental health and wellness. I don't have any studies with me, but I'm sure that we could provide some information and data, at least anecdotally, from the children have expressed the increased stress to them, the additional time required, all of the pressures, and you're right, it all adds up. So I'll be happy to provide more data and do some research for you.
Thank you, I appreciate that. And yeah, I would definitely encourage, more investigation as much as it is possible.
All right, let's see. I guess I'll go
To my left next, Ms. Lacey.
Thank you, Madam Chair. I have to ask a COVID question because you can't not get asked a COVID question when we're sitting as the Board of Health. Can you tell us more about what we are doing to identify and support people who have developed long COVID? And for folks who have been, at least it's been in certain news reports lately, new studies done showing that there's a pretty high rate of people who were asymptomatic when they were first sick, they didn't know, and then they got long COVID. And I kind of feel like that's something that we would want to be thinking about for, say, the future, the next 6 months between, now and the next time we sit as Board of Health. So I'd like to know what your thoughts are looking in the future about that.
Yeah. So we meet regularly with our hospital partners, with Arundel Medical Center and Baltimore Washington Medical Center, and we've had this conversation with them a number of times. Both of those hospitals have dedicated services to address long COVID. I believe at this point it's probably been more than a year for both of them. And so I think in the county we're well positioned to be able to care for them. A lot of what their care is focused on is a multidisciplinary approach. Also recognizing that it's in early days, right? There isn't a clear definition, there isn't a clear treatment paradigm. Right. I think for us, what we're thinking about is how do we increase awareness of that, right? But ultimately, it does have to be addressed in the healthcare setting, and I think we're well positioned to be able to do that here.
Okay, thank you.
Mr. Volke.
Thank you, Madam Chair. So one of the things that you talked about, Doctor, was the school health services that you provide, and I know I get emails from people who are in the school health service every year around budget time. We are in budget time. Can you just talk a little bit about, I mean, you've indicated that yes, there is a disparity between what they're paid here versus in surrounding jurisdictions. I know that you had a plan, it was a 3-year step to try to take their compensation up. Anything else that's coming? I mean, I have not fully gotten to go through the whole budget because we only got on a Friday, but if there's anything in there that we should know that kind of speaks to that, or if you have other plans, I'd just appreciate if you could address that, because I know there are people who want to hear that.
Yeah, absolutely. Thank you. I thank you for bringing that up. So 3 years ago, prior to COVID, our intention was to address this in 2 ways. One was to have a 3-year plan to increase salaries, at the same time to participate in a compensation study to understand not just salary, but the full compensation package, what that needs to look like in comparison to other counties. COVID intervened and made that a lot tougher because nurses, as we know, there is a shortage, and that was only exacerbated by COVID. So as we are enacting our plan, it is falling behind while we're trying to push ahead, I think is probably the bottom line for that. And so we are looking at the state level. There's been state adjustments to nursing salaries. Those are things that just on top of whatever they're doing that we need to recognize that needs to be layered onto what we're doing with our school nurses and also our school health assistants. So I think that's kind of the broad picture, is that we're going to need to be aggressive to be able to keep up. I mentioned the 70% turnover. We are barely ahead in terms of our staffing. So for all those people that have left, we have to hire somebody. And that's a lot of churn for a department.
I have a brief follow-up, Madam Chair. Thank you. So just to follow up on that, I know you're going to be in front of us, I think, soon.
Thursday,
on your budget.
yes.
Yeah. If you have anything more specific than that in terms of proposals or what you'd like to see, if you can be prepared to address that, that would be helpful, I think, for me, and I'm sure for some of my colleagues.
We'd be happy to.
Thank you.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So I want to go back to the discussion on social media and mental health. We know from the past 2 years that when the Department of Health identifies a problem, a challenge, there is the ability to do outreach. Because the Mental Health Task Force has identified social media as a trigger for challenges for our youth, has there been any thought into putting together some type of panel that presents this information to parents in the county, much like the Not My Child of years ago, that was very successful, that goes through, maybe with our state's attorney, what we're seeing in social media apps that parents should look for, kind of the pitfalls that you might not know if you're not cool and hip like the kids today. Any thoughts on that?
I mean, I think that's a good idea. I don't want to speak to what's already taking place, but what I can do is make sure that I'm in sync with Ms. Meikler, with particularly Ryan Voteland, and making sure that that kind of education is taking place. I know that digital citizenship is a big part of teaching kids, some of the things that you're mentioning, right? I confess I'm not on these platforms because I find them just challenging. So I don't have the words either probably to describe it, but
Okay.
I'll follow up with you after I talk with them.
Great, thank you.
Go ahead, Ms. Pickard.
Thank you, Madam Chair. Allison Pickard, District 2. My colleagues asked great questions. I don't have any questions. I just want to once again commend you and your staff, all the staff of the Department of Health, for the heroic efforts that you've made. Every time I had to go get a COVID test, or I would get a little emotional in line, I think your staff up at Bay Meadows thinks I might be a little crazy, because it was just it was awe-inspiring to watch them work with citizens day in and day out, no matter what the weather, sort of they were out there, and that's what I saw. So I know that there's so much more going on within your department, and I think if we could say it's a silver lining, I think COVID has definitely shown a bright light on the need for public health, and I hope Anne Arundel County will rise to that occasion and continue to invest in public health and our public health workers. So thank you again, everybody here and those who aren't here, for the work that you do, have done, and will continue to do to keep Anne Arundel County healthy. So thank you.
Thank you.
And seeing no more lights from my colleagues, I really just want to kind of piggyback on what my colleague, Ms. Pickard, said, and just give everyone here representing your various subsections of the Department of Health a round of applause. And we'll be in touch. We'll see you Thursday.
Indeed. Thank you all. Appreciate it.
All right, ladies and gents, this concludes our May 2nd, 2022 Board of Health meeting. We will now return to our regular meeting. At this time, we will open our invitation to audience, and I just want to read, before we begin, one of the rules that is always a good reminder to have. That's one of our council rules, Rule 4-106, Order and Decorum. The presiding officer of the County Council shall preserve order and decorum during each meeting or session of the County Council. The presiding officer shall have general supervision of the County Council chambers and over each corridor adjacent to the County Council chambers. Visual demonstrations such as waving placards, signs, balloons, or banners are prohibited in the chamber. Any person making personal, defamatory, or profane remarks, or who willfully utters loud, threatening, or abusive language which disturbs the orderly conduct of a session of the County Council shall be called to order by the chair. The chair may seek removal of any individual who refuses to abide by the provisions of this section. In case of a disturbance or disorderly conduct in the County Council chambers, the presiding officer may order such place to be cleared. And thank you for taking that little reminder. At this time, we will open our invitation to audience. Madam Secretary, do we have any comments or communications on subjects not included in the printed agenda received from members of the public?
No, Madam Chair, we did not receive anything ahead of time.
Thank you. We did not have anyone sign up online before this meeting for this part of our meeting. However, if there is anyone here who wishes to speak on a subject not included in the printed agenda, please come up to the table and state your name and address for the record. All right, and I don't know if either of you would like to go first. You kind of had a tie at the table, so. Thank you. State your name and address for the record, and you have 2 minutes.
Yes, David Dull, Severna Park, Maryland, 21146, Vice Chairman, Libertarian Party of Maryland. So I will be here less frequently. 2 minutes, I got like 2 things to say. So cause of death from COVID, we should put an asterisk next to that because, you know, if you're dying of something else and then you also have COVID, we're not really sure if those numbers are right, so maybe we should take a second look. Vaccinations, testing, masking, treatment, but nothing about eating healthy until after we stopped talking about COVID, even though 76% of people who were hospitalized apparently were obese. Masks, the masks changed. I do believe that according to the CDC, the regulation, I had the mask. Anyway, the N95 masks have been proven to stop the spread of the virus, but the other masks that everybody has been wearing the whole time were not. And I believe that the CDC said that before we even knew that COVID existed. People don't trust the treatment. Well, maybe that's because we were constantly being told that monoclonal antibodies and ivermectin were evil and bad and were never going to work, and oh my God, it's horse tranquilizer. And, you know, now my doctor, when I went to the ER, was telling me to take it. Nobody died, or we didn't see a mass death at the homeless shelters, even though a lot of these people weren't vaccinated. And gun violence, young black males are dying. I know Republicans, excuse me, I don't mean to attack you, but some people might say, well, you know, that proves a certain issue. Maybe we should look at ending the war on drugs, because maybe the reason why people are killing each other in the city is because over drug turf. So if we just reversed the 50 years of Democrat Jim Crow drug laws, we could solve the problem with gun violence in the cities. I really don't like the idea of the government coming in and grabbing my kids before they're in kindergarten. But that's another subject. So good thing, oh man. We'll have to do, Ms. Picker, we'll have to talk later.
Thank you very much. And Mr. Ateto, 2 minutes, state your name and address, and you have the floor.
Philip Ateto, Poplar Avenue, Annapolis, Maryland. Congratulations on passing the shiny, impressive turd of a bill that was 1622 to form a police accountability board. This was a once-in-a-generation opportunity for us to get some police accountability, and boy, did you pass a turd of a bill. You created the worst possible scenario, a PAB that gives the illusion of transparency, but with no actual accountability. How does it feel? I know the satisfaction and relief of passing an impressive turd. You got it passed with the labor and discomfort that comes with passing a giant turd, and then thought you could flush it and move on. However, what you don't understand is that this was no ordinary turd. Unlike many of the bills you passed, this turd is going to come back and haunt you. When you lay a turd, it stinks. I hope the stench from this bill haunts you for the rest of your life until you fully understand how much you're betraying the most marginalized people in our communities, and you work to right the injustices you're allowing to continue to be perpetuated. None of you batted an eye when Chief Alwood said, quote, "We believe in transparency and accountability to ourselves," end quote. Are you serious? Please think about that statement some more and how problematic it is. You have the audacity to ignore all of the Black and marginalized voices from local communities that came and testified in the past weeks and pass a powerless PAB bill that could have meaningfully improved justice for Black and marginalized communities and hold accountable one of the primary historic tools of white supremacy. And then the very next meeting you take up and will probably pass this performative resolution condemning all acts of racism and the discrimination and intolerance depriving of human rights, which does nothing for people, and that the police have been a chief perpetrator of over the years, and there's been unaccountable to the communities they serve. If you voted against amendments like the one that would have allowed people with past convictions serve on the PAB, and tonight you vote for the resolution against racism, you have no self-awareness and no shame. I hope you all take a long, hard look in the mirror tonight and think deeply about your role in upholding white supremacy. I'm not counting on that based on what I've seen from you. Whenever you smell crap, just know it's this bill and the harm you've caused haunting you. I'm disappointed but not surprised. FYI, when you pass a whopper of a turd, the stench lingers, and it can stop things up for you a bit. See you in the streets and on the campaign trail.
Thank you very much. This panel is dismissed. If there is anyone else who would like to come down and share their thoughts with the council at this time, you are welcome to do so. All right. In that case, the invitation to audience is now closed. Is there any item any council member would like to place on the agenda? All right. May I have a motion that the partial reading of any bill, resolution, amendment to a bill or resolution, or minutes constitutes the reading of the whole?
So moved.
Is there a second?
Second.
All in favor?
Aye.
Opposed? The motion carries. Madam Secretary, please read the minutes of April 18th, 2022.
The meeting was called to order at 7 p.m. by Ms. Rodvian, followed by the invocation and the Pledge of Allegiance led by Ms. Hare. The meeting was held in the County Council Chambers, Arundel Center, Annapolis, Maryland. There were approximately 75 persons in the audience.
Thank you. May I have a motion to approve the minutes of April 18th, 2022?
Motion to approve, Allison Pickard.
Is there a second?
Second.
Thank you. All in favor? Opposed? The motion carries. The minutes of April 18th, 2022 stand approved as read. Madam Secretary, please read the titles of any bills to be introduced this evening.
Bill number 4922, an ordinance concerning finance, taxation, and budget, special community benefit districts tax. Bill number 5022, an ordinance concerning finance, taxation, and budget, revenue reserve fund. Bill number 5122, an ordinance concerning personnel, classified service, exempt service. Bill number 5222, an ordinance concerning personnel, positions in the classified service, positions in the exempt service. Bill number 5322, an ordinance concerning planning and development, master plan for water supply and sewerage systems.
Thank you. Madam Secretary, please read the titles of any resolutions to be introduced this evening.
There are no resolutions to be introduced this evening, Madam Chair.
Thank you very much. At this time, we will move on to Bill number 31-22. Madam Secretary, please read the title of Bill number 31-22.
Bill number 3122, an ordinance concerning zoning BRAC mixed-use development.
Thank you. This is Ms. Lacey and Mr. Pruski's bill. You may each make a statement if you like.
Mr. Pruski's
Yeah,
going to go first.
Thank you. Madam Secretary, could you please put the slide on the screen while I'm talking, and then you can remove it, but I think it's 1 second, everyone. Okay. Good evening, everyone. I'm a co-sponsor on this bill, and I wanted to highlight a few facts and clarify some misinformation that's being put out there, and also explain why this bill is being put forward. What you see on the screen is Fort George G. Mee, along with the National Security Agency. It is bordered by I-295 in the west, the BWI Parkway, 175 north, 32 Maryland, and 198 south. There are 129 agencies that serve on the base. If you look at the green sector in that area, there was close to 1 million square feet that is new mission facility that's been added over the past few years. And I'm going to cite the county executive's letter, obviously, that was sent out because it kind of matches what's there. Of course, due to the mission at the base, you don't get hard data for a variety of reasons. But with the office space, 3,000 people will be joining us in this upcoming year, another 3,000 the next year, another 3,000 in 2026, and an additional 3,000 in 2028. I am only sharing with you what is publicly on base. There's additional data, which I'm not going to take the time to go through, about the contractual basis that comes with the information here. But I want to highlight some of those things about what I just said. And to be clear, the base is not going to go back on bringing people. They're coming. So for those that have the misconception or that's put out there that these folks are not coming, they are arriving. Some of them are starting arriving now, and they're there. But a couple of things, I had people email me that this plan supersedes the Odenton Town Master Plan. That is not true. The Odenton Master Plan is under review right now and is currently there. Fort Meade is going to continue to grow, and I gave you numbers that, again, does not include the additional folks that will be added with those families. We have no authority over zoning on base. We've learned that since BRAC in 2010, that any discussion or occurrence that goes on base with employment or zoning that occurs is actually done by the federal government. So we have no choice. So obviously, if they say they're going to add employees, they are coming again, and I think it's important to recognize that. I want to acknowledge that there's been challenges, and there's also been benefits with Fort Meade. Certainly, the folks that live in many of our neighborhoods have had the benefit of good paying jobs and having the economy going on, but it's also brought some challenges with traffic, schools, and infrastructure. And one of the things that I'm proud of with the county executive's budget, and certainly hopefully in the next state budgets, that we will continue to improve our roads and infrastructure to go along with the continued growth. Notice what I said, continued. This is not something that's going to stop, it's going to continue. Also, I often hear that people can work and just live in another county and drive to Fort Meade. Well, the last I checked during COVID, if you ask employees that work at Fort Meade, and I've actually knocked on neighborhood doors throughout my entire community, many of them are wanting to live close to base. Why? Because we recently had a COVID pandemic where they would rather be home to be with their child. Their bus doesn't show up on time, so they have to drive their child to school. And in addition, if you have a healthcare issue where you're living with seniors or other people in your family, you want to live closer to base. And again, I could go through a whole bunch of other listed reasons, but I wanted to make sure this is clear. And I think there's another misconception that kind of bothers me. The county council that sit before us in 2010 actually passed a BRAC mixed-use bill. They knew this was coming, and it's been on the record since then, and there's only been 1 or 2 projects that have been listed. So the BRAC zone currently already exists. It's not something that's being created. It is being changed. And I mentioned to you why. I keep getting, why is the bill occurring? Because that green zone, even though it has 1 million square feet, has a lot of people connected to it. And I'm just going to say this. I want to thank the active duty military and civilians that are protecting us right now. And I want you to remember that when we're making these decisions, because they live in our community. They're the ones who are serving right now to protect us, particularly what's going on in our world. And that's why this bill is coming forward. Again, there's management decisions, but I just want you to think about that as we have these discussions. Thank you.
Madam Chair.
Go ahead, Ms. Lacey. Oh, Ms. Lacey, go ahead.
Thank you, Madam Chair. I just want to add a couple of points to what Mr. Pruski said, and I'm trying very hard not to duplicate anything he said, but one of the misunderstandings about this bill from, I think, pretty much the moment that we introduced it is that it is somehow allowing this high-density residential use to be allowed in all sorts of areas where it wasn't allowed before. And that is absolutely not true. The bill takes a countywide conditional use that applies in C4, W1, and the mixed-use districts.
I'm so sorry to interrupt, Ms. Lacey. We've detected a smell of something that may be burning in the chambers, and so we would like, I guess, to ask our officers to take I don't know, walk around and see if they can identify anything. And actually, let's take, the council take a brief recess. Let's see, it's
Point of order, can we just remove the individual that's dressed inappropriately with signage, as we already quoted the rule for -106, and I think that might solve all of our problems this evening.
Madam Chair, the
I-
last time this happened, we took a recess, so that the chair and Madam Secretary.
Let's clear the chambers.
all right. We will clear the chambers. The council will be in recess, and we will come back as soon as we are able. All right, ladies and gents, the County Council has returned from our recess, and we were beginning to discuss Bill number 31-22, and Ms. Lacey had been sharing her background on the bill, and I will apologize. I think I missed 90% of what you said.
Madam Chair, that I'm used to not being heard 90% of the time. Okay, the main point that I was trying to make is to point out that this BRAC mixed use that was existing in the current code applies across the county. This bill focuses this conditional use on the same zones, but only within a target area of a 4-mile radius of Fort Meade. So one of the things that has come up as a point against the bill has been an idea that we are somehow undoing the work of the Region 2 Stakeholder Advisory Committee if we pass this bill. And I just think it's important for everyone to understand that no single regional advisory committee can make us pass a countywide bill or not, or change a countywide use. What the stakeholder advisory committees are each going to do, is clearly very valuable, and we appreciate what they're doing, but they don't have that say. We're the body that has that say, and so we can determine from Plan 2040 and the goals that we passed, we said we wanted in Plan 2040, and then we can go ahead and act on them if we agree that the time is right. And the time is right for many of the reasons Mr. Pruski stated. We can't afford to not support Fort Meade in this growth. And with that, I turn it over.
All right, thank you. Let's see, at this time, administration, Mr. Barron, on behalf of the administration, you would welcome to respond.
Thanks, Madam Chair. Joining me as in the previous meeting, we have Lori Rhodes, our Deputy CAO for Land Use, our OPZ Director, Stephen Kai-Ziegler, and Lynn Miller from OPZ, as well as Kelly Kenny from the Office of Law. As the discussion happened at the last meeting, and there was a motion to hold, which the administration supported to allow some additional time for public engagement. Just want to recap very quickly some of the administration's comments and why we are supporting this bill. And I'll let the experts at the table go into a little bit more detail. But to be clear, this is a council bill, and as Councilwoman Lacey noted, this is the council's prerogative. The administration did not bring this bill forward. Not to say that we don't support it, but there are lots of issues around that are stakeholder advisory committees, and before that, all the work that went into Plan 2040, which identified needs like this bill throughout the county, throughout our region, where we need to change certain things in our code to make it better match the reality. And we have planning process going on. The county executive did send a letter to the Stakeholder Advisory Committee. In it, he reiterated his commitment to their process. They are going to go through their process, and we are going to be fully behind the work that they produce. Plan 2040 itself recommends that the county council pass legislation to implement its call for smarter, greener, and more equitable land use practices. The thing that I think we've sometimes miss in these very complicated land use discussions is how this all fits in when you're looking at a very narrow piece to the bigger picture. So let me be clear. This bill does not relax any environmental regulations. It does not change adequate public facilities as it relates to roads or schools. I'm going to turn it over to the experts who can speak much more eloquently than I on the merits of the bill, but I do want to appreciate the sponsors for working with us and taking some of our suggestions, as well as their advocacy for the fort and smart growth. Lori?
Lori Rhodes, Deputy Chief Administrative Officer for Land Use. Pete, I think you touched on all the important points in this bill. As what everyone has stated, this bill, BRAC mixed use development, has been in the code since 2010. The refinement under this bill would shrink and focus that area 4 miles around Fort Meade. I particularly happen to live in West County in Seven Oaks, and I can tell you a lot of residents in my community work on Fort Meade, and they're looking for housing. So I have personal experience. My husband actually works at Fort Meade, and I'm jealous because he just can go right across the street, and he definitely says that his colleagues really want to live closer to where they work. So I think this bill will provide those opportunities.
Thank you, Lori. Steve Kai-Ziegler, Planning and Zoning Officer for the county. I think the council members have described very, very well the purpose of this bill. I get it. And with Mr. Barron and Lori Rhodes, there's not a lot I can add. I'm going to say that when this bill first came in, I'm not, my sense of it was, why are we doing this? But I've had a couple of months to evaluate it. I've seen many of, if not all of the questions that have come from council members to our office. Lynn Miller has, I think, done a fantastic job of responding to those. And the more I learn about the bill and the realities of what's going on at Fort Meade, and when you take into account that their job growth is going to grow 10 to 20% over the next 5 to 10 years that we know of. They're not moving jobs out of there. They're coming. And the reality that we have a number of sites that are eligible for this bill, if implemented, that what it really does is it changes the mix of use. It no longer requires a certain percentage of office or retail or industrial. And I want you to think about that. If we continued with that path for a market that really isn't there, what we'll probably get is large, blocky industrial buildings. From an APF or environmental standpoint, it's very hard to protect the environment when you're talking about a data center, because those buildings have to be built in the configuration they are. If we have somewhat more residential development, whether it's townhomes or multifamily, you have a better opportunity to protect certain environmental features, a stream buffer, specimen trees. You can design, or at least attempt to design, to better protect those. I mean, this bill has, I think it's grown on me over the 2 months that I've seen it. I really don't have any major objection and actually can support it. I commend the council members for being forward-thinking in trying to deal with the realities of Fort Meade. I'd also like to touch on, Councilman Lacey, you talked about the SACs, and I can tell you that if you think about it realistically, we're going to have 9 region plans coming forward, 3 at a time. We have a stakeholder advisory committee appointed with each one. They have a tremendous amount of work to do for what I would call future planning. There is no mechanism, practically, legally, to invite them in to review and I'm going to just throw a number out, the 20, 25, 30 land use bills that individual council members do. There's simply no way to build that in and meet your 95-day limitation for a legislative process. So while I commend their interest, this isn't the place for them to be directly involved as a body. You've gotten a ton of comments from individuals. Mr. Pruski, you had responded. We see that the CE had done the same thing. I'm kind of in the same boat. So, my comments are supportive of what we've already heard so far. Did you have anything? I don't think I need to add anything. Okay.
All right. Hearing no additional comments from the administration's panel, are there any questions? Oh, and there is my first question. Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I do want to thank OPZ, Office of Planning and Zoning, for answering the numerous amount of questions that came over, Friday into the weekend. Maps were provided that were very helpful today, so I really do appreciate it. I know you were inundated on this. For me, I think about if this bill were not to pass, where would these employees reside? And I know that in the 5th district, we have a large volume of folks who travel to Fort Meade every day. Just look at 97, look at 32. And I just can't imagine adding a large volume of vehicles to that traffic, that existing traffic. So I do appreciate my colleagues being forward-thinking. I know it's not an ideal situation, but it's a reality that we have to face. And it's a reality that came from the very, very top. So again, I just want to thank you. I do want to clarify, I think we were all asked, how many units are being proposed? We're not at that stage yet, correct? Yeah.
So we don't have development applications into
Right.
review that would have come as a result of a passage of this bill.
Thank
so
you.
it's a theoretical question. I would love to be able to answer it. I don't know how to.
Thank you.
Ms. Pickard.
Thank you, Madam Chair. Allison Pickard, District 2. I've read every email that's come over in the last month. I think it's important, just to put it out there into the public, that when bills are introduced tonight, there were several introduced. Council members and their staff immediately get to work going through those bills. Some we already know a little bit about before they're introduced. So, you know, when the public hearing came forward 2 weeks ago, I was prepared to vote for this bill because I'd already done my homework on it. But when we talk about the merits of this bill, there was a lot of back and forth. One, we're not rezoning anything. All those parcels will remain W1, C4, mixed use. That is their zoning. And with that, they can, by right, be developed in certain ways. So the environmental impact exists there, whether it's residential, a commercial warehouse, industrial use, it's there already. And this body, has put forth, we've strengthened environmental protections in our development process and our stormwater management. So there's putting out those fears about environmental the bill being environmentally detrimental is just not accurate. When we talk about, I appreciate the talk about employment, but we also have a housing crisis in Anne Arundel County, in the state of Maryland, and in the United States. And we know from the Maryland Department of Housing and Community Development that Maryland is lacking over 200,000 units of housing currently. And then we expect to gain about 176,000 new residents to the state in the next 10 years. Anne Arundel County has a low tax base. We have good schools, and we're attractive for many reasons. People like to live here. We also have those, I think it's 5 of the largest employment generators in the state in the northern part of our county. We also have newly built homes. A single family home, newly built, is at $800,000. I can't afford to live in an $800,000 house. A new townhouse, newly built, is an average sale price of $550,000. There's a lot of factors that go into making those statistics, but the lack of inventory is definitely one of them. And then we've heard about school capacity and our overcrowded schools. As the adequate public facilities representative from this council for schools, we also know the largest generator of student yield is generational turnover of homes already built in this county. So I appreciate the folks that are engaged in land use and the advocates. I don't want anybody to disengage, but when we look at individual bills, the thing I would say to our advocates out there is please look at legislation within the context of the entire code, and if you have questions, before you get really upset and oppose things, ask those questions and be prepared. Reading the code is not easy, and if it weren't for my legislative assistant, I would be going crazy. But we pick apart and we have to reference other parts of the code, and you can't read Article 18 and forget about Article 17. Development has a lot of rules to follow. So I'm really pleased that we're here with this BRAC bill. We'll have some other bills over the next year, 2 years, 3 years, 5 years that look to modernize our code to solve problems in our land use policy before all of our region planning is done. It's just a fact. 7 of us were elected to solve community problems, and we're all eager to do it. As Mr. Kai Ziegler pointed out, we have a lot of land use bills annually, and this is a small one, but I think it is going to serve the communities in West County well, because many of those communities also want the commercial, entertainment, restaurant, amenities that other communities enjoy, but their residential development is not sustaining. So I know the 198 corridor would like a tablecloth restaurant. They have a lot of fast food, but that is what comes when there's enough residential development. So good job to my colleagues for putting this bill together, and thank you to the administration for supporting it tonight.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. In the emails that were coming and going over the course of the last few days, there was concern that we were doing things backwards, and I can certainly understand where that feeling is felt among folks who have been very involved in land use and planning for the future. But when we're typically talking about residential development, it's if you build it, they will come. But in this scenario, they are coming, and this is where we're building.
I think my colleagues have already said all the things that I wanted to say, so I'm going to just say ditto. Seeing no additional lights at this time, Madam Secretary, please call the roll on Bill number 31-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Point of order, Madam Chair, I don't think we had a public hearing on this because we held the bill from last time.
We did. We held the,
Thank
and
you.
I'm sorry, I may
Nope.
have skipped that.
Nope, thank you very much. Aye.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Bill number 3121 has been passed.
Thank you, Madam Secretary. Please read the title of Bill number 33-22.
Bill number 3322, an ordinance concerning zoning, residential districts, requirements for conditional uses, townhouses.
This bill is, Mr. Pruski is the sponsor, so you may have the floor.
Thank you, Madam Chair. I actually want to start off with a story so under people, again, have the genesis of where this came from. About 3 or 4 months ago, I was door knocking in my community, and I talk about community West County District 4, and I ran into a gentleman who works for a particular agency, and he described to me his frustration, and I asked him, what is your frustration? And he said to me, the lack of choice housing in Anne Arundel County. And I said, what do you mean by that? He was caring for both his mother-in-laws and in-laws, and also had an uncle who was living with him, multi-generational, and he said that obviously he's trying to find housing that has multiple choices in a community. And he goes, I said, can you give me an example of what you're referring to? He said, well, I always look at Howard County, and you look at the communities that are described where you have seniors living next to condos, apartments, and single-family homes, and it's well planned. And I asked him, I said, well, obviously some of those are planned unit developments, PUDs. You know, some are obviously planning in terms of what's listed. And he also talked about affordability. In the same description that was described earlier, that the range for someone to buy a single-family home is just not there, but a townhome is acceptable, but he'd like to see, obviously, the rest of his family be there. As we looked at the general development plan, one of the things that was made very clear is that we have to look at flexibility, and that includes, in many districts, this bill is limited to R22, when the requirement that would change here is that R22 would be a 1-to-1 ratio with multifamily. Again, it's not all townhomes in R22. And also to clarify for the record, this is something that I had sent out to someone. R22 is actually, townhomes are actually allowed in R22 under a PUD. That's actually still there. So technically, you can already do townhomes in R22 from what's listed. Also, as the Planning and Zoning Office could testify, Not every R22 parcel will take advantage of this. This is a conditional use. For those that don't understand conditional uses, there are certain requirements that are required for them to be along there. Also, this bill has, well, let me be clear. There's about currently 12 to 15 parcels. I don't know, they have the exact number, but in that range that is R22. And I believe 8 or 9 of them are already developed. So we're really talking about 6 possible properties if you look at it depending on what's there. But I believe offering a diverse housing options in Anne Arundel County is good for Anne Arundel families. And notice what I said, housing choice for families. We have a choice here, and I'm going to make this simple statement and I'll stop here. No jurisdiction in this country has increased affordable housing by restricting housing choice. I'm going to repeat that again. There's no jurisdiction that's done land planning in the country that has increased affordable housing by restricting housing choice. Anne Arundel County has a cookie-cutter approach for years. We need to look at it from a different lens, and that's what I believe this bill does. It's a policy position. It does not remove APF, does not remove Forest Con, development requirements. There's a lot of things that have certainly been added, and I can probably ensure that there hasn't been a lot of modifications approved in the past few years as well as a part of the record. So I want to make sure that's clear what this bill does and what it does not. Thank you.
Thank you very much. Mr. Barron, you may respond on behalf of the administration.
Happy to, Madam Chair, and I've got the same team here sticking with me, Team Land Use. So I want to thank the sponsor. There has been some discussion. This is a challenging issue. As we noted in the last bill, you have to look at the whole picture of land use. We did work with the sponsor to bring a slightly clarifying amendment. Hopefully the council will accept it. We did have some concerns when this was initially brought forward, but after working with the sponsor, we're comfortable with the bill. And I'll let Ms. Rhodes or Mr. Kai-Ziegler add any of the technicals on it if you would like.
Chief Administrative Officer. As you've indicated, Councilman Pruski, housing choice does make housing more affordable. Initially, when I looked at this bill, I was concerned because we know the multifamily dwelling is the most affordable, but having that commingling of housing choice allows that transition from like townhouse to multifamily. And because they will be combined in the development, I thought, townhouses require a minimum lot size of 10 acres. This one would be 5, so you would have a floor of a minimum lot size of at least 5 acres. So we're not looking at those large developments, especially in R22 where the land area is very limited.
And Steve Kai-Ziegler, Planning and Zoning Officer. I just have really a very short planning philosophy. As good planners in a community, what we're always striving for when it relates to residential uses, we like to see a variety of housing types, ownership options, whether it's owning in fee or rental, and also different price points, whether it's a rental fee or buying something. And when you get the right mix of those, you have a healthy community.
All right, thank you very much. At this time, are there any questions from my colleagues, or are you ready to go to the public hearing? All right, seeing no lights, we will now open the public hearing on Bill number 33-22. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we did receive 5 submissions ahead of time through the online testimony tool that were seen by the entire council. Summary is posted online, and they will, of course, be included in the record.
Thank you very much. Madam Secretary, do we have any testimony? I'm sorry. We did not have anyone signed up to testify in advance. So if there is anyone who is here who wishes to testify, you may come up to the table at this time and state your name and address for the record. Is there anyone who would like to testify on this bill that's here? All right. Seeing no movement in the audience. Oh. Yes, unfortunately. That may have put a spin here. The public hearing on Bill number 33-22 is now closed. Madam Secretary, please read the title of Bill number 33-22.
Bill number 3322, an ordinance concerning zoning, residential districts, requirements for conditional uses, townhouses.
Thank you. And there is one amendment. Madam Secretary, would you please read amendment number 1?
Amendment number 1. This amendment requires that the development be located on a development site of at least 5 acres.
Thank you. And Mr. Pruski, you're also the sponsor of this amendment.
Thank you, Madam Chair. As a part of the discussions regarding this bill, we wanted to get it right. And I think that one of the conditions that I worked with P&Z in discussion on is that there should be a minimum set of acres, and we wanted to clarify that to make sure that it's clear, and there's no questions about it. So that's what this amendment does. And again, I hope that we can get a second and support.
Second.
Oh, okay. All right. Any discussion on this amendment? And Mr. Barron, you may now chime in.
Just appreciate the sponsor bringing this forward. Part of the discussion came back when we were going back and forth. We didn't want to add an additional bureaucratic step if there were multiple lots, making folks combine them. So using some language that exists in other places in the code is how we came up with this. So hopefully you'll pass the amendment.
All right. Any additional? Mr. Pruski, your light's on. Are you? Nope. Okay. Then that said, Madam Secretary, please call the roll on amendment number 1.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Amendment number 1 is adopted.
Thank you, Madam Secretary. Bill number 33-22, as amended, will be heard on May 16th, 2022. All right. At this time, we will move on to resolution number 10-22. Madam Secretary, please read the title of resolution number 10-22.
Resolution number 1022, resolution supporting the Caucus of African American Leaders of Anne Arundel County in condemning all acts of racism and the many forms of discrimination and intolerance that have deprived people of their human rights.
Thank you, Madam Secretary. And I am the sponsor of this resolution along with Ms. Lacey. And I will go ahead and go first if that's all right with you. I won't read the entire resolution, but I will tell you that when I took this office, I promised that whenever I could be, I would be a voice for the constituents in my district, regardless of the color of their skin. And Carl Snowden, who's the leader of the Caucus of African American Leaders, asked me to bring this resolution on behalf of the caucus. And it's very simple. It just asks us as a council to condemn all acts of racism and the many forms of discrimination and intolerance that have deprived people of their human rights. I would say that unfortunately in the past several years we've seen more instances of situations where racism is come again to the surface. And I will tell you, again, I always drawing on my personal experiences, which I know we all do, but in my personal experience in the classroom, I've had more instances where students either said things, made inappropriate racial remarks. Students came to me and told me that other students said inappropriate slurs to them. And this has just unfortunately been a pattern that I've seen since about the beginning of 2017, maybe a little bit earlier, but it's been particularly pronounced since then. And so I think, we're given the opportunity here to stamp this out and say clearly as a body that we condemn racism and that we're not okay to stand by and allow comments, acts to be condoned, and that we'll stand up to it. And we want our children in our schools to do better, to treat each other with kindness, and to judge not. I think we could, use Dr. Martin Luther King's words to say that we're not going to judge people on the color of their skin. But unfortunately, we have seen that, and I will tell you, in my experience, it's been an uptick, and I think we have statewide data that shows that as well. So, with that, if I guess I make a motion to adopt, or Ms. Lacey, would you like to make any comments here?
Just briefly, Madam Chair, thank you.
I'm sorry, I didn't mean motion to adopt. I'm getting tired. I'm thrown off a little bit.
I will be very quick.
Go ahead.
I think that given that Anne Arundel County has a very, 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 very long history in this continent and what became this country, and that for a very, very, very long portion of that time, our state allowed slavery, and we know that generations of people benefited from that practice, and generations of people were very harmed by that practice, and that it was based on the color of their skin. So, since we are supposed to know better now, then we have to do better. And anyone who feels they cannot support the mission of racial equality or recognize the efforts of our county's citizens to eradicate racism and all forms of bigotry, including anti-Semitism and Islamophobia, and to recognize an organization that has been leading the way in condemning all acts of racism and the many forms of discrimination and intolerance that have deprived people of their human rights, well, I really would like to know why you can't support those statements. I just would like to understand. Thank you.
All right. Any questions or comments from the administration? Mr. Barron.
Thanks, Madam Chair. Joining me is our Equity, Diversity, and Inclusion Director, Pete Hill. Obviously, the administration supports this resolution. This weekend, was the annual Walk in the Woods and the Say My Name ceremony at Crownsville Hospital. And I'm really glad that I went, because Mr. Snowden actually spoke at the event. I know I saw a couple of you there. And I'm really glad I brought my daughter with me. The history in this county is not we're not going to end racism with a resolution. But we need to teach our history, and we need to help make sure that everyone in the next generation, most importantly, understands the effects of places like Crownsville Hospital and the effects of that treatment that is still felt today. And I want to thank the sponsors for bringing this forward. And I'm going to turn it over to Pete Hill for any comments he may have.
Pete Hill with the Administration, Equity, Diversity, and Inclusion Office. Earlier tonight, a gentleman said that this resolution was merely performative. They made that same argument about the Emancipation Proclamation when it was first issued. I would suggest to you that anything that has happened great in this country started with somebody in your position of power uttering a statement. John F. Kennedy said that by the end of his second administration, I will place a person on the moon and bring him home safely. NASA came into existence. Woodrow Wilson said we shall make the world safe for democracy. We kicked butt in World War I and made the world safe for democracy. I would urge everybody on this council to consider what you will utter tonight, not necessarily verbally, but in this written form, where it clearly says, a resolution supporting the caucus of African American leaders of Anne Arundel County in condemning all acts of racism and the many forms of discrimination and intolerance that have deprived people of their human rights. Simply by uttering those words, you can put things into motion that can help change the calculus for the next generation. And so I would urge everybody with the power to vote in the affirmative. Thank you.
Thank you very much, Mr. Hill. All right, we will now open the public hearing on resolution number 10-22. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair. We received 3 submissions through the online testimony tool that went to the entire council. It's included in the summary that's posted on our website, and of course, it will be added to the record.
Thank you. We did not have anyone sign up to testify in advance in person here, but if there is anyone here who wishes to speak, you may come up to the table and state your name and address for the record. Seeing no movement in the audience, the public hearing on resolution number 10-22 is now closed. Madam Secretary, please read the title of resolution number 10-22.
Resolution 1022, resolution supporting the caucus of African American leaders of Anne Arundel County in condemning all acts of racism and the many forms of discrimination and intolerance that have deprived people of their human rights.
Thank you. Go ahead, Mr. Volke.
Thank you, Madam Chair. I am very happy to support this resolution this evening and vote in favor of it. It reminds me of a bill that I put in last year, Bill 8121, that called for no spending of county funds that were discriminatory, with a definition that discrimination meant a belief that any sex, race, ethnicity, religion, color, or national origin is inherently superior or inferior, that individuals should be adversely treated on the basis of their sex, race, ethnicity, religion, color, or national origin, or that individuals by virtue of their own sex, race, ethnicity, religion, color, or national origin are responsible for actions committed by other members of the same race, sex, ethnicity, religion, color, or national origin. So I felt then, as I feel now, that this was a non-discriminatory bill that I put forward. It seems to have the same sort of crux of the argument as what we're doing today, where we're saying we are condemning bigotry, racism, and intolerance, and where we are looking specifically at race and religion, which were two of the things that I was trying to address with that bill. So I certainly hope that all my colleagues tonight, as we vote on this bill and as we support this and as we make this public statement as the council, that hopefully we could revisit that topic to ensure that we're not spending county funds in a discriminatory way, just as we want to ensure that we are saying that we do not agree, and in fact we condemn affirmatively all acts of racism. So with that, I will be voting yes, and I do hope to have your support if and when I bring back this bill. Thank you.
All right. I just want to make a little bit of commentary in response to my colleague's words. I feel like my colleague has missed the point. Racism in the United States is not something that has gone evenly in all directions. In fact, racism really is about power and about certain groups having power and using it to harm other groups. And the fact that we are still seeing that the ripple effects of hundreds of years of that power differential in our lives. And, you know, we saw it in the data from the health department today. It is not a coincidence that the groups that are most vulnerable are people of color. And that is a direct result. And if you need reading material to understand why that's a direct result, I can pull some things off my bookshelf, even though I'm not drawing any titles to my memory at this very moment. But this is not about, we cannot talk about racism as if it can go freely in every direction. Racism in the United States has been the dominant group, the most powerful group, that is white people against people of color. And there's a reason that the Caucus of African American Leaders is the group that that requested this resolution, and that I want to honor their request. I know lots of stories about things that people have shared and the kind of discrimination that they faced right here in this city in their own lifetimes. When the schools in Annapolis desegregated, teachers of color, some teachers of color, were brought on to teach in the newly integrated high school. They had students, white students, literally turn their chairs and face and put their back to their teacher, their black teacher. They basically made it clear that they were going to ignore their black teacher. On the flip side, in those newly integrated schools, you had black students who were sitting in the classroom with white teachers who basically told black students that they were not going to teach to them, meaning they were going to focus their efforts on the white students in the classroom. Those are stories that I have learned actually by attending meetings of the Caucus of African American Leaders and listening to elders who have spent time in this community. I have also heard young people in my very own in my very own career as an educator, students of color have come to me and said, a white student has asked me for a black pass. And I said, well, what is a black pass? It's basically, can I have permission from you, a black person, to use the N-word? So this is not ancient history, and this is not something that goes in multiple directions. So I'm not going to pretend that this is, that racism is something that white people experience. It's not. Discrimination, maybe, that's entirely different. But when we're talking about racism, we're talking about a power differential. And I think it's really important to understand that that's what this resolution is about. It's not about the kind of thing that was presented in my colleagues' previous legislation. And with that, I still hope that I will have Mr. Volke's support to make it clear that we are denouncing all acts of racism, that we are supporting the Caucus of African American Leaders to eradicate racism. Not that we are going to pretend that different races do not exist, but that we are going to commit to eradicating racism. And with that, Mr. Volke, you may have the floor.
Thank you, Madam Chair. I do still intend to support the resolution. I'm reading on page 2, and it says the council joins the Caucus of African American Leaders of Anne Arundel County in condemning all acts of racism and the many forms of discrimination and intolerance that have deprived people of their human rights. So my understanding of this is we were talking about racism, we were talking about discrimination, we were talking about intolerance. As noted previously, it referred to racism, and then it also talked about forms of bigotry, including but not limited to anti-Semitism and Islamophobia. So that was why I was seeing the parallel between 8121. But I understand we have a difference of opinion here, but I do look forward very much to supporting the resolution. So thank you for bringing it.
I'm glad to hear that, and of course. With that, Madam Secretary, please call the roll on resolution number 10-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
Mr. Volke.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Resolution number 1022 has been adopted.
Thank you, Madam Secretary. Is there any other business to be brought before the County Council at this time? May I have a motion to adjourn?
So moved.
Second?
Second.
All in favor? Aye. Opposed? The motion carries. The County Council is adjourned until May 4th, which is this Wednesday, when we will meet virtually to hear department budget presentations, and we will begin at 9 o'clock a.m. Thank you.